Hello, I'm sitting here with Greg Fontana, who is a cardiac surgeon that practices in Los Angeles. He's currently the president of the International Society for Minimally Invasive Cardiac Surgery and has been a leader in many of the seminal transcatheter aortic valve trials in this country. He's a world-renowned leader in the field of minimally invasive cardiac surgery, and we're particularly delighted to have him here today. Greg, welcome to Houston.
Thank you. Great to be here.
You picked a nice time of year to come here.
Thank you very much. Yeah, it's a real pleasure to be here. Every time I come to the Texas Medical Center, and specifically to Methodist, it amazes me all the activity and excitement and building that's going on. And clearly this facility where we are today with the Mighty to have the Revolution Symposium here with these fantastic speakers in the morning and moving right into hands-on didactic sessions that are being led by the experts in each of these subdisciplines. It's really quite an exciting format, I must say.
Well, how do you see this partnership with ISMICS evolving?
Well, I think it's a natural evolution. ISMICS is the only international organization that focuses on minimally invasive cardiac surgery. We're 20 years old now and have nearly 900 members from 6 continents. And our annual meeting, which this year is in Montreal, is the North American meeting. Next year we'll be back in Europe. The meeting continues to grow and attract a true international audience where we get together and bring new technologies, new ideas, new techniques, and discuss them. And we have great debates and keynote lectures, as well as presenting the academic information that is important to really the core to this academic exercise. That said, one of the missing pieces has really been a more practical approach to transferring this information and educating and training surgeons. And I believe this format at Revolution Summit represents that opportunity. So it's a natural relationship between the organization and this meeting, and I see it having a bright future, one that will evolve and re-evolve down the road.
Well, we have a commitment to education here at the DeBakey Institute for Clinical Education and Training, which is part of the Houston Methodist Hospital system. And one of the things that we've done is to find the funding for a fellowship in minimally invasive cardiac surgery, which we've just, in fact, advertised. Our intention is to get surgeons in practice to come and spend 6 to 12 months a year with us. It'll be fully funded, where they will learn principles of minimally invasive cardiac surgery, transcatheter aortic valve replacement. As you know, we have a busy program here with Mike Reardon and TVAR. So we are very excited about that. Yesterday, we had a lunchtime keynote talk given to us by Brian Duncan, who is the medical director of our Mighty lab over here, and he talked about telementoring as a method to leverage distance learning and to make some of these techniques more scalable. Tell me your thoughts on that.
Well, I think it's critical. We've been quite limited by the ability to move mentors and proctors around, and these are not techniques that can be learned in an hour or in a day or in a weekend at a course. It requires really an ongoing relationship. And even when the surgeon and the team has an established program in transcatheter valves or minimally invasive valves, there's always a new technology that comes along, and to have to send out an expert to hospital case by case by case to continue the educational process and the growth process is really impractical on one level and expensive on another. So being able to use technology so that the physician, teacher, mentor can stay home essentially, but interact on an ongoing basis is very efficient. And some of the technology we saw yesterday very effective in the way the operations and the imaging, et cetera, are conveyed back and forth. So I think it's a very important advance, and clearly you're setting the gold standard here at your institution with Dr. Duncan's program.
Well, Greg, it's a great pleasure to have you here. Greg Fontana, the current president of ISMICS. Thank you very much.